Hey everyone, welcome into Live with Greg. It is Thursday afternoon. I'm so thrilled to be joining you today talking about colon cancer. March is Colon Cancer Awareness Month, and today I'm talking with Dr. Lynn O'Connor in just a few moments about a little bit more detail about the screenings and preventative factors when it comes to colon cancer. But first, I want to bring in Ron Norman this afternoon. He is based in New York City. Ron, how's it going this afternoon?
It's going well, Greg. How are you?
I am doing well. Good to be talking with you. First off, we're talking about colon cancer awareness, and this is something that is near and dear to your heart. Share your story with us this afternoon.
Yes, absolutely. So I had gone into my regular doctor's office, and she was basically telling me that it will probably be best if I go off to see a specialist for a particular issue that I was having. And as I went to the gastroenterologist, he basically suggested taking a colonoscopy while I was there. Not that particular day, but just to prepare to take one. I was thinking, like, at the time I was only 29 or so. And I was like, I don't know if I should take it this early on, because I've heard that most people take it around 40 years of age. And then I thought, you know, why not take it? Because I have a personal experience with my pastor. Growing up, my pastor of my home church in Woodruff, South Carolina, he was diagnosed with colon cancer, and I just know the struggles that he had to go through during his journey. So I just figured, why not take the chance to go through and get tested. So I went through the process, and I documented it on my YouTube page, and I spoke about the experience and what it was like to go through that process. But to add some statistics to the topic is the fact that many people who are diagnosed with colon cancer are African Americans, and the people who are diagnosed with the disease, many of those folks, many of the African Americans who are diagnosed with the disease are dying from it. So I figured, why not get tested? And I did, and fortunately, everything checked out clear, and I'm good.
So grateful that you are okay, but also going back to your pastor really influenced you to make sure that you take this serious. And he was diagnosed at 39 years old in 2016, yes, and in South Carolina, and he passed away, unfortunately, last year.
Right.
What did he tell you right before his passing about, you know, colon cancer and the importance of making sure you take it serious?
Right. So we never really had that conversation. I just remember going through, interacting with him through his journey, and just seeing how frail he would get at certain times, and just knowing, like, him talk about the doctors that he would have to see, and just that whole process was something that was weighing on me. And actually, the day after I got my colonoscopy, unfortunately, he had passed away. So the fact that it happened that close together, and yeah, he was definitely a driving force behind me actually going to get the colonoscopy. And then not only my pastor, it was, you know, Chadwick Boseman, who's also from South Carolina, and some other prominent Black figures who have passed away at an early age. So I figured, why not get tested, and why not tell everyone else to get tested as well?
When you think about, you know, your experience, for people watching out there who may not want to go to the doctor to get checked out, what would you say to them right now, considering everything you went through? And you're not even over 40, you're in your 30s.
Yes, I'm 30 years old now. Mm-hmm. And I would just say, basically, just take care of yourself, prioritize your health, and go get tested. There's nothing to it. They will put you under. I had some propofol. The anesthesiologist told me about propofol, and I was like, wait, didn't Michael Jackson die from propofol? And he was like, if it's administered in the wrong way, any medicine that's administered in the wrong way could be deadly. So he was basically saying, you will be fine. The process probably lasted about 15 minutes. And I woke up, I was in the waiting area, and the process was harmless. And they basically showed me images of the colon and everything. And they were basically saying that there are no issues, nothing to be worried about, no cancerous polyps or anything. So great news there. But unfortunately, like I mentioned, my pastor who passed away and his struggles, and the unfortunate fact that so many other Black men especially are dying from this disease. So I think it's important to get tested.
So important. Ron, thank you so much for sharing your story this afternoon. I really appreciate it. And certainly my thoughts with you and your pastor's family as they're still going through the grief of losing him just a year ago. We really appreciate you talking to us.
Thank you so much.
So as we move along this afternoon, I want to bring into the conversation Dr. Lynn O'Connor. She's the founder of the Colon and Rectal Surgery of New York in New York City. And she's also the chief of colorectal surgery at Mercy Medical and St. Joseph's in New York. Dr. O'Connor, thank you so much for talking to us.
Thank you. Thank you so much for having me.
You know, when you hear stories like Ron, 30 years old, African-American male, why is it that colon cancer is affecting so many people of color these days?
Well, colon cancer, when you look at cancer itself, it's the second most common cause of death in the United States. It's only surpassed by heart disease. And then when you look at colorectal cancer, that's the second most common cause of cancer death. And for African Americans, unfortunately, we are 20% more likely to be diagnosed with colon cancer, and we're 40% more likely to die from colon cancer. And a lot of it has to do with health, with our risk factor prevalence, disparities and access to healthcare. For instance, go ahead. We're going to say.
Go ahead.
I'm going to say, for instance, you know, if you're looking at high-fat diets and you know, lack of fruits, lack of vegetables, you know, diets that are high in processed and red meat, physical inactivity, and then really disparity, access to care, folks that are not able to get screening colonoscopies, low health insurance. Those are the things that are really plaguing the segment of the community that's causing risk factors to rise.
Will you talk about colon cancer for people who don't know what it is? Can you describe that for us?
Colon cancer is really what happens are you have normal growth in the colon. They're just fleshy growths that continue to grow. So a cancer is a normal cell that is now growing unchecked. We have processes in our body that if something grows, we stop. Sort of like when a patient has a cut and a keloid and it keeps growing. Well, for instance, but that's not a cancer, but it's just your cells keep growing. So when you're in the colon, there are some cells that are just keep growing, and then it becomes a cancer. It outgrows its blood supply, and it breaks off, and then that's when it metastasizes.
What are some of the symptoms and warning signs people need to look out for?
The key thing is getting screened before you have symptoms, because once you start having symptoms, that's when you're looking at advanced disease. So some of the symptoms that patients experience are really a change in bowel habits. So you're not moving your bowels regularly. You start to become constipated. Where you normally went every single day, you're going every day, every other day, or every 2 to 3 days. The size of the stool is now different, where you have smaller pencil-thin stools. If you experience rectal bleeding, because tumors and polyps bleed, so as the stool passes by the tumor, you can start bleeding. Abdominal pain, where you're just not feeling really good, or you feel as if you've only eaten a little bit and you're full. So that's what we call early satiety. Weight loss is also another symptom that patients have because the tumor is just not allowing them to eat. And so those are some of the main ones.
When you talk about screening that is available for colon cancer, what's out there, what's available, and when should people start getting those screenings?
Well, we're finding that not only is colorectal cancer high incidence in African Americans, it's also increasing in incidence in the young. So the cohort of people who are diagnosed with colon cancer, 20 years ago, the average age was 72. We're now down to 66, and that's because we're seeing a rise in younger patients. Anywhere as young as 20 to 39, there's a 1 to 2% increase in colon cancer and a 3% per year increase in rectal cancer. So as a result, the American Cancer Society recommended screening be decreased from 50 to age 45. So that's when a patient should be screened. And age 45 is people who are average risk, meaning you're 45 years of age, there are no signs or symptoms, you're just 45, and that's when you get screened. If you start having those signs and symptoms, such as, like I said, rectal bleeding, change in bowel habits, abdominal pain, weight loss, that's when you should get screened sooner. If you have a family history, that's when you should start getting screened.
When you look at this and you look at so many different situations when it comes to colon cancer, There's prevention that is out there, and you talked a little bit about that before. What can people do that are watching to start hopefully prevent something like this from happening?
There are several key factors that people can do. The first thing is mitigate or modify your risk factor prevalence, which means eating right. Whole grains, high fiber diet, fruits, vegetables, lots of fluids. That's what you want to do every day. You should at least aim for anywhere from 20 to 35 grams of fiber a day. Cutting down on red meats, processed foods, high saturated fat, that's exactly what you want to do. And physical activity is key. If you can have at least 30 minutes of moderate exercise 5 times a day, or just 75 minutes of vigorous activity 3 times a day, you can cut your colorectal cancer risk down to 16%. And patients who've even had colorectal cancer that hasn't spread, if they exercise, they can reduce their risk of recurrence by at least 24 to 50%. So those are the things that you can do. And on top of that, screening. Screening colonoscopies save lives. That's the only modality where you can actually detect it and treat it. And a lot of my patients say, what's the best screening test? There's so many out there. There's Cologuard, there's the fecal occult blood test, the fecal immunochemical test, but the best test is the one that's done.
And I'm sure we've heard about, the preparation when you're going through the screening process or getting ready for the screening process. A lot of people look at it and may say, you know what, I don't want to do that. I don't want to drink the nasty, whatever preparation stuff. But what would you say to those people out there who are having those thoughts in their mind, how 1 day or 2 days of preparation could just possibly save your life?
Well, the one thing I tell my patients, first off, you can prep for me to do a colonoscopy, or you can prep for me to have surgery and take your colon out. You choose. So if you prep to have a colonoscopy, it's really a simple 1 day prep where you're just having clear liquids like apple juice, Jello, chicken broth, ginger ale, Italian ices. And you can have that. You can have some weak tea. Just make sure you're prepping, you're staying hydrated. And we have several different preps on the market today. They don't have those huge, big volumes where you're drinking, a ton of prep that's nasty and tastes like seawater. We have so many different preps. We even have pills that are out on the market at this time. The most important thing is to prep. And it's a very seamless process. It's 1 day, and it can give you the peace of mind that you're screened, you're protected, and you're cancer-free at that point for when it comes to colorectal cancer. It's a small test, and we can prevent that. Just as much as we get mammograms and we get pap smears, we can get colonoscopies.
When you talk about the treatment options when it comes to this, what treatment options are out there for people that are watching?
Well, the first thing is if you have a colonoscopy and there's a polyp and we can remove that polyp before it becomes a cancer, that in and of itself, can prevent the cancer. If we're actually doing a colonoscopy and we find it in its early stage, that's a 95% 5-year survival. If we are not able to remove it during a colonoscopy, then for colon cancers, it's usually surgery. That's the primary modality for cure. If there are lymph nodes that are there, then patients may go on to have chemotherapy. Certain cancers, like in the rectum, depending upon the size and location, they may need what we call neoadjuvant, which means treatment before surgery, such as chemotherapy, radiation, and then surgery. But surgery really is the mainstay because you want to remove that tumor, get it off to the pathologist, get it examined, and see where you are. But surgery is really the mainstay of treatment for colorectal cancer.
Dr. O'Connor, I really appreciate you joining me this afternoon and talking about this serious subject. And I want to ask you one more question. You have been doing this for over 20 years. Why did you choose this particular field of medicine to practice, and why are you so passionate about it?
Because this is one area where we can really make a difference. If we do what we need to do, if we're screening, if we're eating right, if we're exercising, we can wipe out colorectal cancer. We can prevent it. And even if a patient does develop it, if we're screening, we can screen early. And there's a 95% 5-year survival. So this is something that, I love education. I love prevention. I love a holistic outreach when you're treating patients. And if we need to actually treat it, I love the fact that these patients do well. If they're taken care of and they're diagnosed early, my patients do well. And that means the world to me. That really means this is where you can make a difference. You can make a difference in the beginning, the middle, and the end. You can really make a difference.
For people watching, if they have any questions to ask you, perhaps on social media or perhaps calling your office, how can they get in contact with you or your office if they have questions?
Oh, if they have any questions, I'd be more than happy to speak with them. My office is 631-350-6277, 631-350-6277. My address, my email, website is Colon and Rectal Surgery of New York. So it's just www.colon and rectal surgery of New York, all spelled out. And you can find me as Dr. Lynn O'Connor on LinkedIn, Twitter, Facebook, YouTube, Instagram. I have all of the social media outlets there because it's important to get this message out. So I'm out there if you want to find me. It's just Dr. Lynn O'Connor.
Dr. O'Connor, thank you so much for joining me this afternoon. And I'm also going to put your website on this post on Instagram and also on Facebook. I really appreciate you for taking time to talk to us about this serious subject.
Thank you so much for having me.
Thank you so much. Have a good day.
You too.